to echo. All right, let's try that again. Good evening, everyone, and welcome to the Dunn County Health and Human Services Board. I will call the meeting to order. Today is Thursday, July 23rd. Let the record show that Supervisor Bashan, Supervisor Hagan, Supervisor Welch, Chair Morehouse, Dr. Hall, and Ms. Rudy are present. Supervisor Steen is excused. Mr. Lamb said that he might log in, but he left today for vacation. So I think we should not expect him. We have meeting minutes from our last meeting, which was June 25th, 2026. I could use a motion to approve. Dr. Hall moves. Is there a second? Supervisor Bashan seconds. Any additions or corrections to the minutes? Additions or corrections to the minutes? If not, all in favor say aye. Aye. Any opposed? The minutes for June 25th are approved. I assume we don't have any public comment? Nope. All right. Next meeting is August 27th. Summer's almost over. Isn't that? Yeah. Okay, Dr. Hall will be absent. We will miss you. Oh, perfect. So we should convene at the dress rehearsal. Cool. Okay. All right. We don't have any items placed at the request of the chair, but we do have our operational plan back up, and I assume I'm handing that off to Dan. And thank you for printing out the big one. Even I obviously need new. Yeah, it was nice, but I needed new color cartridges in my laser printer. This is better.
So I will point out that document that is printed out is different than the one that was in the packet.
Okay.
The larger one reflects the original document that was shared with the program plans. The one in your packet had some changes to some of the programs, and I think just kind of identifying whether they are basic or better.
So say that again, please. I'm not sure we all understood it. How is this different than the one we studied?
So some of the programs that are listed in there, so like Child Protective Services in your packet is listed as basic. It's listed as better in this list, and in the original program reviews, it was also identified as better.
Okay.
So there's and Paula can speak to some of those changes as to whether they are basic or better. I think they're maybe a basic, really small plus.
Basic plus.
When Becky and I looked at this week and prepping for this, I'm like, well, how did that get better? That should be basic. That's why I changed it, because I'm like, that's not better. And so then when Jenna let me know this afternoon that this was changed back, I'm like, okay, maybe it was because we had put it because like family treatment court in child protection is better, but it's like one program. The whole unit though would be 99% of the unit would be basic. And then you have that one program that would be better. And like the youth justice, we got the innovative grant for the garden. So that piece is.
So they're both on this list as better.
Because it has a couple of those pieces that are in there that we've gotten grants for previously. So I think that's what would have maybe twisted it to the better, but the majority of the unit is just basic. It's not something that's better than other neighboring counties or what's mandated.
Okay.
So, and I wasn't even thinking like this is different than before. I was just like, oh no, that needs to be fixed. I need to fix it. Sorry about that.
No, that's fine. I just wanted to make sure we understood what was going on here.
Yep.
Go ahead, Dan.
So I will tell you, I wasn't at the meeting the last time, but so this document is something that the department heads have been working with to kind of put together some of the data that had been requested at the end of the last meeting. So specifically related to the amount of levy funding that is applied to that program. So as you look in, we do have a percentage of levy funding. So that is the percentage of that program's funding that is levy. And then you can also see then the actual dollar amount of levy that is applied to that program. So you kind of work those two numbers together in order to do that. I also want to qualify this with, we don't budget at this level. So this is kind of an extrapolation best guess kind of how much levy is being provided with there. So and I believe the department heads were the ones that came up with those numbers.
Yes, I believe that's the case.
The other area. So you'll also notice a key on the right side identifying that items with red text are mandated at some level. And then the ones with a gray background to them are mandated and already at the basic service level. So that's what keyed Jenna off to the change there, is that those colors weren't aligning. And then we have a pink background, which are the ones that were identified as a high priority in your last meeting. The blue background are mostly non-levy funded. And then the green ones, Jenna and I were talking about that as she was reading me into the document. Somebody else added that color.
That would be me again.
So that's programs that have to meet external certification requirements, right?
So what I wanted to document here, adding that, was that the services, like for example, crisis is mandated. We have to assist people that are in a mental health or substance abuse crisis, but we don't have to have a certified program. The certified program helps us bring the revenue in for the program, because then we can bill for that certified program, but we still have to have the service in these. So we still have to serve people with mental health and substance abuse in CC, in serving those roles. It just doesn't have to be that certified program, but really the certification, again, is the revenue. So if you don't do the certification, you miss the revenue.
So all those indicated as green better are revenue generators, correct?
And they're meeting the mandate of serving those.
Absolutely, certainly. Yeah. So everybody understood that part. Okay. Dr. Hall, please.
So to clarify, providing some sort of mental health crisis service is mandated. We just are providing it basically at a better level where it's certified that allows us to collect revenue for it.
Correct.
So, I mean, really.
Where we are certified. So they
Okay.
could provide services where you outsource it. You pay for somebody to go to another clinic as opposed to having your own certified clinic where then you're taking in that revenue and potential profits that may come along with that to offset other expenses.
Yep. But it is mandated that we provide it. Because I wondered, because I was like, mental health crisis isn't mandated? I was like, well, that's.
Yeah, I think that's where the color coding sometimes.
Yeah,
it
got a
it's
little
confusing.
confusing.
It's a little bit confusing.
Thank you.
Thanks for bringing that up though, Dr. Hall. Go ahead, Dan.
I was going to point out one thing as well. We were talking a little bit before about budget. And it was one thing that did kind of catch my eye related to the behavioral health clinic and crisis. And that's something that you'll see reflected in the budget. And I think it's exactly to that point is I would argue that that levy cost that's in the clinic does not exist in the clinic. It actually exists within crisis. And that is that crisis is paying the clinic. It's a kind of us paying ourselves kind of component that because the clinic is not a mandated item, but that's kind of how that item works around there. So I would say you could move that number to that crisis, and that's what you'll see when you see the budget. You'll see that reflected.
But because these were 2024 numbers pulled from those budgets, it was
Right.
in there that way, but we've done a whole extensive relook at our budget.
Right,
how things are
exactly.
set up.
Okay, yeah.
Yep.
Okay,
So, as I was told, Genesis, I just need you to leave with 5 programs identified for review. And I said, all right, Chris Cruzy's on at 7:00. So, so I don't know exactly where you were in that last discussion. If there's any questions, I think specific to any of these areas that you wanted to have answered, you have Post-it notes. We can go straight to the Post-it notes and put them to the board. I guess I'd leave it to you and department heads to kind of speak to that.
and recalling our conversation from a month ago, I mean, there are a lot of programs on this list that are mandated and basic. And I don't see where there is room there for subsequent review. I don't, unless members of the committee would like to disagree with me. Dr. Hall.
So I guess I'm a little bit, when we say we're recommending it for review, right? Does that mean we've identified this is a place where if we need to cut costs, we think if we had to, this would be where we would cut it? Or is it, hey, let's look and see if there's some efficiencies that the department hasn't thought of? Do you know what I mean? So
I know, I hear you.
it's like, but anyway, I would say, I mean, just the cold-hearted way to do it is to say, well, what's, beyond the basic that's mandated that is a large dollar number program. And I did that earlier today and I identified those, and for every single one of them, I can come up with a lot of good ideas or good reasons why we should still offer those programs at the same level. Because if we cut, it's going to, if we cut mental health crisis, for example, then we're
Exactly.
going to see costs go up for law enforcement. And, if we cut maternal child health, then maybe we're going to see more placements. And so, but
Right.
but that's what it is. So maybe we do recommend those are the ones that you look at, and please, Board of Supervisors, take a look at them and you'll see that it would be foolhardy likely to cut them.
Supervisor Hagan.
Thank you. On the opposite side of cutting anything, for the services that we charge a fee for, I know there's been a little bit of talk of potentially reviewing those fee structures as well. And I was thinking, versus just any like 5 programs that way, if potentially all the programs have with the fee structure get bumped a little bit, that would kind of soften the cushion between any singular program. So potentially that could be a way of
Could be.
reviewing.
When we talked about reproductive health, for example, last month, possibly being able to generate additional revenue. And we don't, yeah,
So just a reminder that some of those, we can increase our charge for those items, but we're not necessarily going to be reimbursed more for that.
Right.
So when you think about reproductive health, absolutely we can charge more, but our largest payer is of sliding fee scale and Badger Care. So that's going to be really challenging. I definitely see that in our inspections, but then you will have an increase in conversation with these regulated
local
committees.
businesses.
Right. So just a
Yeah.
food for thought.
No, absolutely. Thank you. That's useful. Go ahead, Supervisor Hagan.
Exactly to your point that maybe if the fees were spread around amongst multiple programs, that conversation would be less than if we focused on a fewer of them. So maybe.
Other thoughts from the committee before Dan pushes us forward?
I was gonna kind of get to part of your question. So other committees have kind of taken the approach as it relates to review to maybe there are other opportunities in how that service is delivered, thinking in administration. Is there ways of collaborating with the city or other counties in order to kind of, share some of those fixed costs as it relates to different services. So it wasn't so much a review to find a cut so much as is there a different delivery mechanism that could potentially have an impact on the budget.
So I think we can probably keep both in mind, but I mean, there is already a budget shortfall. So, I mean, we're looking at cuts. And maybe there aren't a lot of cuts here in Health and Human Services. But we are a pretty big budget item. So as unhappy as that makes us, that's where we are. Supervisor Bashan?
Just say, looking at the list, I see 4 items total that don't have something in the key. But I would even argue that like the Veterans Emergency Crisis Support is not flagged as a key thing, but if we're talking mental health crisis, then that would be, if it's not done in Veterans, it's gonna have to be done in
Oh, for sure.
Health and Human Services. So we'll color that one green too. Which
Greg.
takes us down to like
I can
3.
Speak a little bit to it. You can't avoid it when it comes into your office. And that's just the
Sure.
allotted time that we estimate that it happens before we get the experts involved, which is, basically it's just managing the crisis at the time to gain the trust and then bring over the experts from Access and stuff. And that's what I would identify if an estimate, if I was to put a number of hours and a dollar amount, that's where it'd be at. It's going to happen.
You're not gonna put a sign on the door that says, "Are you in crisis? Turn around and go across the hall."
Right.
No.
No crisis here. I don't know how Dan's going to respond to this, but in executive committee yesterday, I said that I would like, I mean, this process has involved board members, committee members, but I think that our department heads are the experts here. And I did say that yesterday, that I would like to see the department heads much more involved in this process. And I don't know, I know that it would be putting you on the spot to ask for some observations about areas for review today. But I mean, it would be up to each of you whether you want to do that or whether you want us to continue to stumble forward. I did put you on the spot. I know that.
I had this
I-
conversation with Dan earlier today. It all runs together. That strategic visioning, like where are those areas of priority is helpful to me. Yes, I can, obviously we talked about the places where we can increase our fees. That's an obvious place to look. But if there is a different priority that you want me to either shelter or protect or really key in on, that's helpful information. But I understand that it can be a both and, where we can lift some things up, but I'd really like to hear what your priorities are.
Okay. All right, that's fair. Yeah. Yes, Paula, Greg. Okay, all right. We're moving forward then.
So if we want, we have yellow Post-it notes. If you want to identify some of those areas that you would like to have looked at. I guess one of the things that I look at as I look at even some of the basic and the mandates, they're vague. I mean, if you read them in statute, they are vague. part of that is because those mandates have to work for Washburn County, Milwaukee County, and Dunn County.
Right.
So I mean, I think there's flexibility. There's no doubt that it's providing a lesser service, but and I think somewhat to what KT's saying is that's a little bit of that guidance of what is really those areas that are we want to protect, which have been identified, and so maybe this is a little bit of you know, if we had to give some place, this is a place that we could give. And scale can help in that. I mean, if there's, I'll pick on the highway department because I'm here, right? There's 40 workers in there. 40, I think it's 40 operators in the highway department. If they had one less, the impact there is small. It probably has
Minuscule.
more to do with vacations and
Exactly.
different things like that. So I think there is something to be said about providing that service at scale where a larger area can handle some of those hits at a different level. So yeah, versus yeah. He's working on getting another 8 hours. So.
What does the yellow mean? Just that we're
This,
filling for
Sure.
that?
So, the three blocks that are yellow are all in public health. And so let me talk that through. Great question. So in SAP, we put all of our environmental health revenue in one line. And so that was revenue for well inspections, that was revenue for restaurant licensure. And so while the revenue is correct and the expenditures are correct for the roll up, they're not correct for the individual slots. And so if you were here during the exercise that they did last year, you would have seen that our well program was overfunded and our restaurants were underfunded. When you roll those up together, it's about 75% fee for service, 25% levy, and that's more accurate. We didn't ask for more money from the well operators than we needed, and we didn't subsidize the restaurants with wells, if that makes sense. And then the other one is tricky in this and how we did the breakdown, because emergency preparedness is split from emergency management and public health. We both have federal grants that speak directly to this competency, and they were combined. And so I didn't have the ability to say what's Melissa Gilgenbach's and what's ours. And so I just pulled the numbers. Great questions.
okay, good question. Yeah, please. Paula.
May I also give information on the 8521 specialized transportation
Yeah.
program there, because that is a better area, and I wanted to kind of explain that. Our department writes for the grant each cycle, and there's this match that has to be in there to receive the 100 and some thousand, I can't remember off the top of my head exactly what it is, but funds. And so we have a voluntary transportation program within our department, but I think it was like $4,000 we spent last year within our department. And then the rest of it goes to transit. And so that assists, because they do help assist elderly and persons with disabilities. And so for example, I have it on my list to talk to Dan tomorrow about, but one of the things that we've been talking about is the potential of a vehicle replacement and moving that to transit and paying facilities for it. So like it goes across departments as well as a way to be creative with some of this. So that 27 comes out of our budget, but it really, majority of it is, or 2 years ago, we purchased a bus for NDC. So
Right.
that came out of that. So it's like across
Right.
departments. So I just wanted you to be aware of that. It's not just all here.
Can I ask a question about
course,
one
Greg.
of the programs, the substance use? It's showing, I view that as a profit of 78,565. just as far as an understanding, if there's
Yeah.
more, if there's more
I had a question about
input,
that
do you
one
get
too.
more? Is there more revenue, and is it revenue that comes in to reduce that levy?
That's a really good question. I think this is some of the goofy math of 2024's budget because our behavior health unit is all put together in that budget. And so it may pull of that line, but it might have been a negative in another in the behavior health. And so
I did think that was.
yeah,
It's
there's
kind of
definitely
crazy.
no negative, and I'm going to talk about substance use later on in the budget because there's just not enough money in that fund as it is. So I think that's a matter of the way it's split out from that whole behavior health funding. It's definitely not making money.
Well, we didn't think you were making 80 grand.
Mhm.
But it's a useful question because I didn't understand it either. I didn't understand it either. Yeah, yeah.
All
It
right.
did.
I'll leave it to you to take some time, fill out your Post-its, and we'll see what we get.
Was there guidance on not touching mandated, or anything's open for
Well,
this?
I would argue, and I suppose people can argue against it, if it is mandated and basic, I think we shouldn't be touching it. I could be wrong about that. I mean, there could be efficiencies to be gained, but
I'm just looking to put some guardrails.
yeah,
to-
that
to my
would be the
decision-making.
guardrail that I have applied as I think about this. Did you disagree, Dr. Hall?
I agree and disagree. So
Okay,
I think it's a really great filter as we think about it. But then as Dan mentioned too, the statutes are kind of vague. So is there room to cut back on some things and still be meeting the letter of the law? Perhaps. Is there a different way to offer the service? Perhaps. So, my first round, I wasn't going to touch things that were mandated and basic, but
and it's potentially possible that there are modifications, but I would argue that it's pretty remote.
probably yes. But also, I can think of so many good reasons why nothing else should be cut back that you're
I know,
kind
me
of
too.
grasping at straws for, is there some place where maybe we could make some changes that would result in some efficiencies?
Supervisor Hagan.
Yeah, I just had a question. Bringing up the specialized transportation program again and how that crosses with the highway department, or not the highway department, the transit,
Transit.
sorry. With the transit department. Are there any other services that could potentially be crossed with another department for more efficiency? Does that make sense?
Yeah. Or shared services or whatever.
Yeah, if a
And I
different,
assume that there are some.
yeah, if a different department could be more efficient in how they handle certain things, is that something to consider? And I don't even know how to think of how to consider that. But
I don't know how we would
Throwing
do
that
that.
out
We have
there,
to
yeah.
think about what we can do here. But yeah. Supervisor Bashan.
I know a lot of, as we're looking at the percent levy funding, a lot of the other money is grants. But do we have a maybe quick breakdown of some of these services that would be revenue and like fee service impacted? So, because we can say go find more grants, but that's not highly realistic in this day and age, but the revenue we could touch
Everybody
faster.
tries, right.
Yeah. So are there things in here that are revenue that we could change, even if it may not be the best?
Go ahead, KT.
So that's kind of what we were talking about with the licensed facilities. That's not grants. That is fees for a service. And then the other revenue sources that are not grants in the health department are then Medicaid or fee for service sliding scale, which would be a little bit harder. But yes, we always, for flu shots, we always check around to see where are we in competition. We don't want to undercut people. We just want to make it an easy, accessible service. But then again, we have that sliding scale for folks that literally cannot pay. Same for reproductive health. So I don't know that I have other ones, but yes, I do know where those lines are.
It's not as simple as where the county clerk can charge $25 more for a marriage license.
Think we can charge more for flags?
That's going to save us really a lot of money. Big, big savings. Interesting. Where would you get another marriage certificate? Pembine County. Oh, all right, got it. Okay. You want to summarize our task here? As complicated as we've made it. That doesn't surprise me somehow.
We are other committee summary of
Yeah, we failed at that last time.
I think what we're hoping to do is by those summarize conversation with
Got it. Supervisor Welsh.
So
wasn't on.
to clarify,
I know.
yeah,
I'm sorry.
we can include the mandated programs, the mandated services as those to be reviewed, even though they're mandated, because they could still be,
Maybe.
something else could be
Maybe.
some kind, maybe.
Yeah.
So something else could be, okay.
Yep.
All right, thank you.
Yeah, I don't know. Huh? There aren't any. There aren't any. Is that what you're doing?
Well, I looked at things that we charge for, maybe we review it. We bump it up 50 cents.
That's gonna save us a lot of our money in our $1.7 million shortfall. I
Can't find it.
I know, I know.
Oh, sure, we review.
So could something that's been identified as a high priority still be put on the list because could be under review, right? Okay.
I suppose it could.
Mm-hmm.
I know, I don't want
You get-
anyone to be offended.
You get to do this anonymously. So, so this is a couple of years old. I haven't made the most recent one, but the pieces of the pie don't change much. So this particular one is the distribution of the county levy. So this is, we have a $120 million budget and a $25 million levy. So, so, yep. Fees. The fees also would be like Medicare, Medicaid, yeah, those types of reimbursements. So, and you also have to, our full budget includes the neighbors, which is about $20 million of complete cost recovery. So, yeah, so the pie graph on the left is kind of a breakdown of the full all of the revenues that the county has. So you can see, yes, the orange is the fees, then you have grants, you have some state money, some debt, fund balance that particular year. And then this other little pie graph is what makes up, everybody here has now heard me say it multiple times. there's other taxes that we call levy. So sales tax is in there. So this gray area is the sales tax that we have, that being the full levy. And people love the vehicle registration fee, which will pave about a quarter mile of a road. So, yep. And then this is, yeah, so this is expense or department, yeah, all money expenses by department. So
this does include not just the levy, but
Right.
also the grant. So when you think about human services, they're bigger in this pie chart because of the significant amount of fees for services and grants.
yep, it's about 4-1 for human services, somewhere around there of levy to other revenues.
Can you show me the other pie chart that had just the levy, the department? Sorry. Yeah.
So
So
where the sheriff was a much smaller bit of the previous one, it's much larger because it is
mostly levy funded,
90,
right?
I'm making that number up, +%.
Mm-hmm.
Yep.
We're paying a lot on debt.
So funny thing about debt.
Um,
It's an important aspect, because our debt payments are exempt from the levy limits. So if we increase our debt payment, we can increase taxes without a referendum or other items in order to pay back that debt. But we can't borrow for operations. So So yes, it looks like a big piece, but, and I think libraries isn't a huge piece within here, but that's another thing that when we pay for the library is levy exempt. So if we put additional funding into the libraries, we can do that without impacting other areas. So that's one of the big, I think, challenges as it relates to the whole concept around the debt, I think is one thing that is really kind of baffling to to many people, because you think if I, in my home, if I pay off my car, I get that car payment back and I can go use that to pay for groceries. If we remove that $5 million, we can no longer receive the tax revenue for it. So it doesn't, it saves the taxpayer because taxes go down, but it doesn't come back to the services that we provide. And so conceptually, that's one of those, we were talking earlier about, people get it. It's easy to understand a road because you can kind of understand the basics of some of these things that are more complex. You can't associate with your daily life.
Even so, there are concerns about borrowing for the roads, or concerns about borrowing for, the roof in the judicial center, which was falling apart. It's a problem. Helping people to understand. Yeah. Why not? Right. Yeah, exactly.
The toll on every back tax right now because we're all avoiding the highway. So it's like every back
Right.
road is a highway right now.
Right.
It's crazy.
Well, and I had a conversation with Dustin a couple years ago of like, okay, we have so many townships, seventh most in the state.
Really?
We have 850 some
miles.
miles, 59, 57 miles of road, which is that we're like the eighth,
Seventh or eighth.
seventh or eighth, yeah.
I think we might have dropped to eighth because we gave back a third of a mile to a city, a township. But I asked him, like, could we just let some of them go gravel? Like, take them gravel or give them back to the towns? He's like, the towns won't take them unless they've just been fixed. And it costs more to actually take them gravel.
Really?
Because they'd have to rebuild it as gravel.
Because I know Sawyer County has done that a little bit and they're.
Yeah.
All right. After breaking it up, or sorting them out, I'll make the decision that we're going with 4, because it's easier than breaking a 4-way tie. So, so the birth to 3, as well as the play group, was one of the areas identified. The water testing lab, youth justice, and the medical equipment loan are the 4 areas.
Playgroup, youth justice.
Water testing. and medical equipment.
And the water lab to be all of my.
Yeah,
Yeah.
yeah, and I think that's, like, look at it as about fees.
Yep. Yep. So, yeah, I think, yes, correct. I think even a lot of the comments related to the well testing are related to fee structure. So, some guidance there. Oh, added one out of place there. Play group, there's not a lot of comments related to play group. Does anybody want to go on record as to their thoughts related to that, or?
I put that. And I love the play group, but it's not mandatory. And we do use some of our women's mental or substance use block grant for that program to be able to help pay for it because we are helping women that are there with their children and helping to provide natural supports and all of those kinds of things. It's not mandated. We could take that and pay for our substance use whole in there that we have. I love the playgroup, don't get me wrong, but it's not mandated, so that a lot of it is grants from the community, which is wonderful, but the staff time comes from our.
But you also,
Supervisor Sean, fight it out.
could you add a $5 suggested donation to attend the playgroup? Or,
Right, those are some.
yeah.
Supervisor Hagan.
Not to make it any more difficult too, but I know some people who take their children there and they absolutely love it. And it is wonderful.
Yeah, I think we'll have a parade of people objecting to the decision. That's part of the decision.
And-
Increase taxes.
And there are other grants that could be sought after that we just have not found yet. I've found a lot of them, but none of them will include staff time. So that's the kicker. And
I selected that just because it was at the better. I kind of identified if they're at the better level, what would basic look like? And I think that's that longer term discussion, not ideal, but
Basic is the birth to 3 program because everything in that is mandated except for the playgroup.
Right.
That's what basic would look like, no playgroup.
Very well, thanks for sharing. You're right, right. Thanks for sharing on that one, everybody.
Like I said, in the end, we want to do a summary of kind of the reasoning behind it. So, so we have some related, we have water testing, we have birth to 3, youth justice. Does anybody want to talk about youth justice?
I'll throw my rationale behind there. A large item, and it was, and I kind of talked to Paul, it was just do you look at considering changes in child protective services, or do you look at maybe decreasing some of the preventive measures that would be great? You could save money there, but if you have to bounce things down to a basic level, that's the only reason my consideration and throwing that one in there.
And I also did it, but it's the amount of money that would perhaps warrant some looking into. Not terribly well informed, but.
That's the program that is like really mandated. There are some areas, we do have a grant for the youth innovations, but if we
And the
don't use
leadership
money, we
thing.
just send it back, yeah, for the youth. That's all grant funded. So
Yeah,
it's better because of it, but it's all grant. There's no tax levy in it. The only area, because I've looked at this and maybe somebody else's eyes, we do truancy. It is part of a mandate, but a lot of counties ignore that mandate. And we have truancy court, but that's something that that we could not do that service. And
Excuse me.
it comes back in bigger ways, but the rest of it is all, you're talking about those placements, youth that are committing crimes. That's why the dollar's so big. It's about placement. It's very few staff and lots of placement. Just kind of giving you more background.
Yeah, good.
And medical equipment is the last one.
Yeah, I selected that one too. That's a capacity.
You did.
That's a capacity savings. If you, it would decrease traffic, decrease that 15-minute interaction times 800 plus. It would impact free marketing, but it's really not free if you're paying an estimated $20-some thousand, but that would be an hours reduction.
Interesting.
Just as you were saying that, and it just thought just came, but I mean, part of that is does it all need to be done by veterans? Right? There's other people in this building that
Yeah,
may
right?
be able to support that. So some of those different options that can come up.
I also put that, but I put behind it efficiencies. Are there some efficiencies that we could find in the program? I think it's one of those things that it's very publicly known. And so it's
It
one
is.
of those things where like Dunn County does good government because they have the equipment loan, right? So it's a public facing, very well used. So again, it's one of those that if you would take a small amount away, it's some good publicity that we have. But I looked at efficiencies.
Yeah, okay.
I'm coming back to, I believe it was this committee had identified a threat opportunity threat related to volunteers as well. And so maybe there's a component of offsetting that through that component, because it does have a great reputation. There might be some
Yeah, it
people that have
does.
utilized it that say, I'll sit there and
Right.
exchange for a little while. So, yeah.
Okay, you do that. All right, is that it?
Yeah.
We only did 4.
I let don't tell Jenna. I let you do 4.
Well,
There
we had
was
suggested that maybe we do
Yeah,
3.
yeah. There is I believe 4-way tie at that next level, and it's 2 or 3 votes away from this. So there seems to be a logical gap between 4 and the rest. So we'll
Yeah,
go with that.
this has been difficult because it just difficult.
So next steps, let me share. Sure, ready to share a summary document that Jenna got started, and propose that with the committee's approval. So this document kind of starts off with,
Can you make it? Yeah, I can't see it. Wow, okay.
it's jumpy right
So it's this document.
yeah, it's the first version. So this is the draft. So this document goes through and talks about the key opportunities and threats that were identified by the committee. It then goes in and identifies the priority services areas that were identified through here. And then we get down to the services for review,
Sure.
which is kind of a placeholder to fill those in and then provide a summary of the conversation related to those, of what some of those opportunities might be, or the ideas around that. So it's a little different with this committee because in the other committees we're approving this right now. So I guess I would ask if you would be okay with the department heads, with Jenna's assistants, kind of putting this together, and I guess trust that they would provide an accurate summary of the conversation.
I can't imagine that any member of the committee would have an objection to that,
No.
unless I'm speaking out of turn.
I'd say we did it in committee on administration and it really captured the conversation.
All right.
All
So
right,
with that, we'll call that done.
call that done. Thank you, Dan.
Mhm.
Thank you for putting up with us. Okay, we're moving on. And it looks like we're down to staff reports, and it looks like Greg is up.
It started this afternoon, actually. It's great. All right, thank you. I'll start off with the overview of what's happening local state comments, as well as on the federal, and then the current financial. Locally, just an update on we've identified and named, or we're calling it unhoused program donations that came in, and so we're calling it Lifeline. We've created some space, organized some items. We've received from purchase a whole bunch of items, variety of hygiene items, both male, female, sleeping bags, tents, food, those items that will benefit those individuals that are unhoused. Kind of that's first phase. Next phase is identifying the process for our other partners within the building to access those items when they have an individual or family that's in need, because it's not being restricted just to one special demographic. It's going to be open to anybody, and it does happen in every program that individuals want to build trust, or they want to be able to help somebody out. So we're going to get that pushed out hopefully within the next month. And that, I think, we'll see a good, nice impact. Today, we got an individual that's homeless right now that we were able to send him with a variety of items, which will help out. So I'll keep
Good.
updating on that. And one of the primary donation sources just said, "Hey, just tell us when you need more." So they're committed to it, and with their commitment to that, we need to show results. And the pastor was in, and we showed them the kind of what we have going on right now, and also they absolutely know that it's going to be available to anyone within the county. And our partners, the only expansion really outside of our short reach of partners is going to be the Menominee PD, but that's their relationship with Project Hope, and we want to keep that. And then I spoke at the Menominee Unitarian Church. We'll call it a $500 donation speaking fee for going there. They were wonderful, and they too want to help support this program. So that was a good local opportunity, good outreach. On the state level, just a broad description of really the processing time. We've talked efficiencies in every organization. They've made some improvements over the last year with some of their systems, and approval times for a variety of benefits it's really streamlined, not taking long. As long as we provide the right information, they're turning back the outcomes very quickly. Next Friday, the 42nd annual High Ground Heroes bike ride, it's coming through, and that they stop here. The VFW 1039 provides a meal for them. They stay at, I think it's the Super 8. They're in. We help coordinate. I can provide them some water. The Menominee PD is wonderful about providing an escort as long as they don't have other priorities that are going on, and that's a safety issue to get them to the north end of town, and then in the morning get them back out on the road. On the federal level, the federal VA is identifying through some of their efficiency improvements and implementing some new programs, improvements in processing time and outcomes. My comment, I kind of identified what they're stating that they're using to decrease those processing times, and these are initial claims, not appeals. Those are still like wildly long for how long those take. But we just see that there's this inconsistencies, and I think the only reason there's inconsistencies that it's kind of individual based and at the VA level. If something's missed, then it's going to take us long because we're going to be rebutting some of their automated decisions that miss something. Things are going better, but the responsibility is upon us for quality control of the
Yeah.
work that we put forward. Yeah, and we'll be talking round one budget that at a little bit later. And the financial part, I'll kind of jump to that if there's no questions, just since that's the next.
Go ahead, Greg.
So this is the scale down version, I think, to keep it
Mhm.
consistent with all the departments. And at this point, midpoint of the year, don't have any really concerns at this point. If I did have any concerns about it, if I had some questions about some numbers that with the transition with that SAP, the financial team is responsive. So I don't foresee any challenges or concerns as we go forward. The only thing, and that's really not the board's issue right now, it's just us getting our process fine-tuned and how the donations show up. The process to deposit's wonderful. It's just getting that process, and it's more on my end to understand that, to be able to appropriately get it to the right location to spend it.
Okay.
Any questions about that document on the
Any
financial?
question about the one-page financial document? All right.
I'll move to the impact statement. You can look through the other items on here, but I think the impact statement is extremely noteworthy, as we talked a little bit about crisis here and our office's responsibility to ensure that we're getting individuals to the right long-term supports to remedy these really near-term or immediate crisis. This individual been struggling for quite some time due to military sexual trauma. She was in a program up at the Minneapolis VA, and what she needed wasn't, they didn't have the capacity to deal with what she needed at the time. So that did not work out that well. And she had left. Thankfully, she'd been working with staff, Jessica, and just building trust. None of these things happen in a day, and building that trust and moving forward, and just that salesmanship on getting the validation that somebody else believes you.
Mhm.
And really comes down to identifying and showing the markers from all the service treatment records from the assault that had happened. Claim had a positive outcome on the claim, validated the exactly what she is experiencing and what led to that. That opened up more specialized treatment that is necessary, and is down in Waco, Texas. They provide the flight information. We broke down every barrier that could be in the way of not getting there. Make sure that baggage was covered, to the transportation to the airport, to handoff, check in. Hey, you made it. Everything is good. And I think it's been a couple of weeks, and that's that important part of not doing a cold handoff, because this is especially we
Yeah.
try to remedy the multiple stop, but we're all taxpayers, federal government. It's cheaper flight to have a couple stops, and that the anxiety was through the roof. But everything worked out. So I think that is that multiple step process. This individual is going to be in a better spot, and then I think as time goes on, there's going to be less cost, less resource. Sometimes you can't quantify that, but on a health aspect, you can, just having that validated. So I think that was an important
Great.
important win. Any questions about that?
Doesn't look
I'll
like it.
end my report there
All right.
then. Okay,
Thank you,
thanks.
Greg.
Yep.
Moving on to public health, KT.
As promised, in the update, you do have a screwworm
Yeah,
update. You're welcome for that.
I did read it.
You, mostly you. But yeah, just for your own edification, also the ongoing cyclospora outbreak. And again, we talked a little bit this afternoon about how there is some still emerging science to really pinpoint the source of that outbreak. Currently, the Wisconsin DHS is saying that yes, there is an increase in cases in Wisconsin. However, the vast majority of the Wisconsin cases are associated to travel. So they're not
Okay.
part of this outbreak. So just for your awareness. And then our nurse manager was on some very well-deserved leave. And so what you see is maybe a different voice with some of those updates. And so that is very clearly the individuals themselves sharing what they find valuable to the work that they do. And so just
I thought that was
honoring that.
great, actually.
Just honoring those updates. So I don't know if unless there's any other questions. I know we've had a long meeting, we have a longer meeting. Any questions about the updates?
Any questions for KT? All right, go ahead.
So if you look at our financials, again, that one-page update is not unexpected. I will share that the opioid budget did not have an open GL for the health department, so things need to be moved with a budget adjustment. So that will happen. So you see that
Okay.
settlement fund available to us. The salary that goes towards it will be going towards it. It just hasn't to this point. So that was a good thing to see on that one-page report. The rest of it looks reasonable to me. And we're still struggling up with the new definitions for how things are split.
Yeah.
Any questions?
Any questions on the one pager? Go ahead.
Are we talking about budget or what's next for us?
Do you want to talk about the grant, which we can act on a bit later?
Absolutely. So in the packet, we have the rural health transformation documentation. And in that large amount of money, it was a competitive grant for states from the federal government to address rural health. Wisconsin was awarded. Several grants are open. They have very quick turnarounds. And one of the grants I would like permission to apply for. We did a letter of interest, but the application would need to be in front of this board because it will have staffing associated with it.
Okay.
So it is, as many of the federal grants are currently proposed, you get your first year grant is assured, and then you have the opportunity to continue after that. There are large numbers associated with this particular grant. It would be for 2 community health workers. It would pay for necessary training to make sure that they met best practices, as well as supervisory time. So it would be $400,000 for the first year, and then ongoing if we continue to be awarded $400,000. And so that would be 2 new staff members, community health workers, again, folks from the community for the community, being part of the solution. We are looking to, with the support of our community health assessment and our housing action team, or HAT, write for housing navigators. And so recognizing that people do better when they are housed, and when they are connected to housing, then we can start to work on some of those chronic health conditions and be a more traditional community health worker at that point, but starting with housing. We've got the data in our CHA. It's part of our community health improvement plan, our CHIP. Amazing resource with Tracy from ADRC, really helped map out where those system gaps are. There are workshops to help people navigate, which are currently staffed with volunteers. This would kind of codify that process. And also, after we deal with the housing concerns, then let's work with the diabetes. Then let's work with the substance abuse disorders. Let's work with the other health-related issues that after you build that trust, you can then work on. Sustainability measures.
Yeah.
If we are funded, if we're awarded and then continue to be funded, the federal government and the state government are working to have community health worker outcomes be Medicaid reimbursable. So they're trying to do a proof of concept with this grant and then hopefully have some sustainability with billing.
Because I was going to ask you that. I mean, if presumably the grant could extend to 5 years, and then what do we do with the 2 staff members?
And the supervisor, we would also
Yeah,
have to
right.
increase one of our staff members.
Okay.
In it's one supervisor per 5 community health workers. So we would increase a staff member by 0.4 FTE. It could be good.
Do you want to, does anybody have any objection to moving our decision on this to this very moment? All right, I would entertain a motion to, how do we put this? That, yeah, to grant permission to the Public Health Department to apply for this grant. Second. All right. All right. Any further discussion? Any additional clarification needed? All right, all in favor, say aye. Aye. Any opposed? You have your permission to move forward and good luck on it. Sounds like a great idea. All right. Anything else, Katie? All right. So DHS is next. And thank you for the cute report.
You're
Looks so
welcome.
good.
Yeah, you're welcome. You're welcome. Yeah, we had so many bright spots this time, and last month I didn't give a report because we had our annual report, so I had double the bright spots.
Right.
So that was kind of fun. So I will just highlight a couple areas from the report because we have budgets yet tonight as well. The one big news, which you probably seen in the news, was that we were under the 6% error rate, which, you know, we were pretty worried about that, and to be able to come in underneath that. So great job to our team of ES workers across the state to be able to accomplish that number. And then the other thing I really wanted to talk about is the fact that we had some funding that we did not claim in 2025 for the state family treatment court grant. And this was caught, and Carol, our grant claiming person, contacted DCF and asked if we could still go back and claim that. They allowed us to do that. And so that was that additional 50,851. And if you go back to our unaudited total for 2025, we were in the whole $51,228. So that brings us so much closer if the auditors haven't finished the books for 2025, because otherwise we can't put it back there. It has to go in 2026. So I'm not sure yet about that, but it got us so much closer, right?
Inch by inch.
Inch by inch, it's closer. So that was good. The other piece I wanted to mention is I talked a little bit about the Foster Care Appreciation Month. And when I'm going to tie you to the vouchers here, when you look at the out-of-home placement vouchers in this month's report, the out-of-home placements were $123,000, and $57,000 of that was foster or kinship placement. And so what that means is either they are in our local community as far as a foster home, or a relative that has taken someone or a guardianship in that area. And so those are the people that we are appreciating. If we did not have that group, that dollar would look really, really different for us. And so, you know, when we look at the better level and foster care was on there, it's because we do have a foster care coordinator. Part of her job is to do that, to really listen and meet with foster parents and try to support them in their needs. And that is so vital, because if we didn't have them, we would be having to go to treatment foster care, and that would be double the cost every month. And so I just wanted to hold that up and celebrate our wonderful foster kinship guardianship homes. That is what I wanted to highlight in the report. Does anybody have any questions from my report?
Any questions for Paula or Becky? All right.
Okay, financial report. So when you look at the balance for June 30th of 2026, that's this form, you will see that there's some areas that I'm interested in or want to highlight, and that's the placement. I know I keep feeling like I'm banging this drum, but when I look at what's budgeted for placement of, $523,640, and we are already at 427 at the end of June, that's a scary number for me. I shared this last night, and I think that was last night.
It was just last night. It really was.
Wow, that was a long day.
I know.
That, just this last week, there's 4 more kids that we got with significant concerns and, so placement, probably will end up with some expensive placements there in addition to what we've already have in our budget. So, that just, it ebbs and flows, and right now it's flowing up at that high level and just continues. So I just really wanted to point that piece out there. Revenue, we're, I think, pretty good in that area. We know that the revenue is usually a month or 2 behind. So
Right.
as of June, to be at where we are, I think we're sitting pretty good with that, with what's expected. So any questions on that?
Any questions on this one page budget? No. So, all right,
That's it.
that's it. All right. Moving on to some action items, we have vouchers. Again, we have 2 sets. I must confess that I was pretty startled that on the foster care vouchers that the names reappeared. How did she introduce it? What did it say? I don't know. New, like a new form, but the names all went back in. So that one, it was $132,566. The Human Services Fund was $337,675 for a total of $470,241. Any questions on that? I need a motion to note review. Supervisor Hagan wins, and Supervisor Bashan seconds. Any additional discussion? Yeah, please.
I just wanted to add, those are the names of the person that the check was cut to. So the provider, it is not the consumer, it is the provider, but obviously that's, people can go
Right.
down the trail of things. And so I will talk to Brittany tomorrow about
And
that.
that's the change
Oh.
that we had asked for.
You already did? Okay, so
Okay,
Brittany.
we had asked for that initially and it just suddenly reappeared.
Yeah, so something
So,
happened there that
Yeah,
Dan's on it, so that's great. But-
okay, thank you, Dan.
Something didn't get collected.
All right. Okay, all right, so we've reviewed the vouchers, we've acted on the grant. Budget. And Greg gets to go first. Please.
My microphone. So I did want to kind of provide a summary of the document. I know many of you have seen it and looked through it, but just as this is a new format, to kind of walk you through gonna have to zoom, what you're looking at here, and maybe some of the things to look for as you go through this. So we have some different versions of this document. With DHS, we did provide kind of a summary page and then the more detailed version because it is big.
Long. Yeah, and these budget forms are, as I said earlier before the meeting, it's not, they're a little difficult, I think.
Yeah.
A lot difficult.
There's some, I think some maybe adjustments that we need. So, first thing, I do want to point out, and it was one of the big things as we went through this system and working with our auditors is that we really didn't do fund-based accounting. So you will see more of those funds showing up. You see it in the financials
Right.
and you'll see it here. So first item that you see in Greg's is the general fund. So that is a fund, that is the general fund. And so each of these kind of header areas is going to have its own subtotal at the bottom. So we're grouped by fund, then department, then account type, then budget category. And so I'll kind of get into what those are. So department, you can see the green line there, that's the department. We'll refer to that as a division most of the time because it's really what we see that as. And then that next level down is the account type, which says expenditure here. And then that next level after that, you can see where it says salary and fringe expenses. So those are what we call our budget categories. So that summary that you saw in the financials was a summary by budget category. So what we do is we group a lot of these general ledger items or these GL codes into a budget category so we can kind of roll them up. So that's what you see right here is the total of salary and fringe for this division in this fund. So yes, there's lots of line items here, but I think this is probably the place to start, right? Start at these subtotals and kind of work your way back. If you want to say, how come this number changed from this to this, you can go dig into those details.
Yeah, and this category actually accounts for the shortfall on the bottom line at
Yep.
VSO.
Yep. And that's, so that was the budget guidance that was provided, was 0% outside
Yeah.
of salary and fringe. So Greg always does a wonderful job following directions. So, yeah.
Yeah, do you have a choice?
So so there's a shared expenses or shared IT expenses is another category. So if you've seen previous budgets, it was always something that people couldn't change. So this is something that isn't necessarily within the control of the departments to budget that. Next one down is that non-salary operating expenses, which is in many cases where the meat and potatoes are. And so then you can see the total there. And then following that, we get to the end of that account type. So this is the total of all of the expenditures on that next line down. And then after expenditures, we move down to revenues, which also then have those object categories. So this is your levy, grants and aids, and then public charge for service. So you can see kind of the totals related to those. So like that breakdown, right, as we talked about earlier, those public charges for service may have some sort of control, right? How many did we sell and at what cost, right? And then grants are grants and levy is levy. So different kind of knobs to turn in the budget as it relates to that. Then you have your total revenues, and then we get the total for the division. So that division falls in at -16. So, and that's once again, as we look upwards and
At the top.
you don't get to do this for public health and human services, but you can do this
This
for,
one was easy,
for this
easy
one.
to read.
Yep, you can compare
Yeah,
the previous years, and you can see that $16,000 difference
yeah.
right there. So that's what that summary looks like, and then we move down to that next division, and then following that division in the yellow here, you see the total for the fund, which will make more sense in different areas, but these are going to be about the same numbers there. And then you do see a donations fund for Greg. There's nothing budgeted
Right.
there.
Right.
But you see that for both of the divisions. So I just want to go over that and so that you could maybe navigate that document better. I guess the other thing that I would point out is it's kind of hard to see on the screen here, but I think you can somewhat see it in your
We have it.
documents. So you see a general ledger item, and then you'll see some text below that. Those are footnotes. So those are items where the department heads are able to kind of put in some sort of a summary to explain what that line is. And they'll go kind of multicolored. For whatever reason, some of them are indented and some of them are not. And I think that leads to a little bit of the readability
Yeah.
issues.
Yeah.
And
Yeah.
they're all supposed to be. I'm not exactly sure why that happened, but so with that, I won't explain Greg's budget, but I can. So, so
Anything else to add, Greg? I mean, you put this together.
Just some highlights. I
Okay.
think Dan kind of went through and used our budget to give you a little bit of an education, what you're going to see with everyone's. First off, this budget module made it a lot easier. I can just speak for my department. I
Okay.
appreciated that. The challenge, the challenge is the grant.
Apparently, there's not universal
Well,
agreement.
you got to take into consideration. Yeah, there's a different. Yeah, I got a smaller budget to
Right.
keep an eye on. But the overall, a new look that created a little bit of confusion and things is how the grants are embedded right into the full operations and revenue. And so as you read down through in some of the detail, I nested in there in the comments how I'm spending the grant. And again, the grant I have is a little over $16,000,
Right.
so a little bit easier. The numbers aren't going to quite add up, but it's in there. I just have to do some adjustments in the comments. So that gives a little bit more of the explanation. So that's why if you look in the 37.01 division, I think is how we're terming that. You'll see in a question I would ask me is, why do you have rent in there? That's because of the grant, because grant falls into those operating. And if I have a situation where the Soldiers and Sailors Relief Fund, which is a little over $13,000, where the Veterans Service Commission says, we don't like that you spent that money for that individual on that cost, I have the grant that I can use, and that's why it's
Sure.
in there. So that's just another clarification. To look at the 2026 amended budget, salary and fringe expenses, you'll see 290, 428, and then round one is 306, 579. That is not an area that, as the office capacity stands, that's not an area I have control over. So
Right.
that those are numbers.
We know that.
Yeah, and if you scroll all the way down to the end, I'll get to the cliff notes, it shows we need $16,625. So everything else in between explains how we're spending the operating funds, but it looks close to what the intent and the direction. I think we can fit it all within that.
Yeah,
So-
and the salary and fringe, we haven't absolutely figured out what health costs are going to be, but salary increase with 2%. So
So I'll end with that if there's any questions for me.
any questions for Greg?
I'll just say that, we're looking for 16,000. It's not like you can find the 16,000 in your whopping $14,000 budget you can actually change. It's just not there.
Yeah,
Mhm.
that's right. Thanks for pointing that out. We are acting to approve these today, or are we just reviewing them?
You're reviewing them. These budgets are, because this is round one, it's the budget that we're
Exactly.
going to use for the budget workshop. So we don't want to bring this in front of the full board as the first version, having the committee not said looks close.
And I'm happy
So-
about the review. I don't believe that we should be approving this at this point.
Yep.
Unless you want us to do something different.
No, this committee or this board is the only one in the county that does have to approve the budget that is being submitted to the county board along with a plan for that. So that's something that requires a public hearing and public
Right.
notice and all of those sorts of
Right.
things. So it's really kind of administrative, and we can do that
Yeah, we'll do that later.
later.
Okay. All right. Who's up, who wants to go first? Public health or human services?
So public health is a little bit messy.
Yeah, I thought it was.
When I think of budgeting, I think of close enough, horseshoes and hand grenades, and it's not there. So just recognizing that there are some challenges with this one. So one of the biggest thing that you will notice is that when we moved from 2026 to 2027, we've really changed how our divisions look and who's
Exactly.
in those divisions. So there that goes with some levy, but it also goes with a variety of grant dollars. The other thing that you'll notice is that we're still figuring out our GLs. And so you've got some things in the 2026 activity that aren't going to live in that spot in the 2027 budget. So example, our AHEC internship that got put in public health administration. It really needs to go to public health. I'm sorry, environmental health, because it's well fee supported.
Okay,
So those are things that we're figuring out. There's also definitions that we're trying to understand, like educational supplies. What does that really mean, Dan? So things there. But again, so if you look at the first public health admin, you'll see salary and fringe, and I've listed out who those folks are by employee number, and there are percentages of folks in there. If you look at our non-operating expenses, I really did try to attempt to get those to come down, and I am going to, again, take another look at that because I have such a change in my levy-supported salary, not so much in this division, but in nursing when we get there, and I'll talk a little bit more about that. So if you look, so I think admin it is what it is, and I think that that's pretty reasonable. When you get into public health, when you get into environmental health, so sorry, you'll see that I am budgeting revenues that are increased. I think that is still conservative. We are still continuing to build use in our public health water lab. And we are, as has been provided as guidance, increasing the fees for different licensed facilities to hit that 90% or so of direct cost. So you'll see that there. You will also see that there are grants that span divisions, and that's a little bit tricky, but you can see it in the in our salary. So there is some salary added in and added into nursing from environmental health. And that's because the public health emergency preparedness grant supports staffing in both divisions. And so that's noted as a footnote under the salaries in the expenditures. So right there, you'll see salary added for, and that's a person. For grant 15, that's the emergency preparedness grant. So these numbers actually do translate to grants and people for me.
Okay. Okay. Sure about that.
And then a lot of the things that I have in my budget right now, I want you to know if I already know that they're a grant funded item. So like this travel that is related to the FDA voluntary food standards grant. If we didn't get that grant, nobody would go to the National Environmental Health Association conference. It's just the way that goes. And so you might see it in the expenses for this year. If it's not in the expenses or the budget amount, it's because we're not banking on that grant. That specific grant we're going to get. He's already written for it. He already got it. And then when things get a little more crazy is really in the 4103 or our nursing division. And so a couple things about that. So for the last 5 years, we've had a variety of very large grants associated with COVID. So we had COVID grants, we had public health ARPA grants, we had workforce development grants, we had public health infrastructure grants. I believe that we're going to sunset all of those grants in 2027. And so then those costs, which we were offsetting levy with, are going to hit levy again. So we're going to have to look really hard at what does that mean for our staffing levels, because that's staffing. And where can we find levy to support that? But again, we're going to get closer. And the last thing that I really need someone else, so where my my rough edge with the budget that maybe that Greg doesn't experience is all my grants, they're not loaded to start. This is our first pancake. Instead of being able to say, this is what we had grants loaded in, they're not loaded in this budget. And so I did it by hand. And I have someone else coming back and checking my work with this iteration. My hope is I made a mistake someplace, like to the tune of at least 3 zeros, maybe 4. But again, just doing that double check, my hope is that we'll get closer as we continue to review that. And then finally, our last division is WIC, and you will see that that really is grant supported. We are being very conservative, and so you'll remember that our public health nutrition grant, our WIC grants, come from the federal government. It runs on a non-calendar year. The federal folks do their appropriations hopefully in the summer, but sometimes not until fall for what comes live in October. We don't know what October of 2027 is going to bring us, and we are being very conservative with what we think we're going to get. So even with that conservative budgeting, we're still covering staff. We are budgeting a decrease in staffing, though, for your awareness. Again, to stay completely grant funded. What else jumps out at you as curiosity or question prompting?
Dr. Hall.
So I was looking at the bigger picture, and so salary and fringe for administration has gone down significantly and nursing has gone up significantly. And I'm assuming that's just because people got moved around. So if you could just remind us what that is.
So in SAP, our public health admin also held nursing positions that had mandated services associated with them. So all of our WEDS work and some of our communicable disease work was rolled up into public health admin. It's what I inherited.
Okay.
And as we have an opportunity to be more granular with this setup, we've moved them back into nursing. Okay. What we have not done are the grants. And then we're going to pilot a project for our reproductive health clinic. And so that you'll see in the next version. So again, we're going to have some granularity to be able to track that a little bit better. But yeah, we took 2.5 nurses out of public health admin, and now they're
in nursing.
Okay.
Yeah, but that was sort of, at least in my review, it was initially extremely confusing. What happened
I was like,
here?
wait,
Wait a minute. What's going on here?
More than one somebody.
Right. Any additional questions on the public health budget? Anything else you want to add? Yeah, all right, this is still moving.
Can I
This is
point
round
out
one. Certainly, Dan.
one area that KT has in her budget, and Paula even more so in hers. And so you may have noticed a line in the salary and fringe expenses here that is, it says S&F budget reallocation. And so what that is, when we have an individual who may be 10% here, 5% here, 20% here, something like that. In the old system, what we would do is they would build that into the person's budget. So this percent of their salary went to this area, this percent went to this area, this percent went to this area. We're trying to go away from that model, specifically when those positions are allocated via time study. So
Right.
it's one thing to say it's 10%. That 10% was an estimate. The actual comes out of a time study. So what we're doing is budgeting 100% of them to one area, and then the department heads are using that salary and fringe budget reallocation to kind of move some of those salaries to where they expect the time
Yeah.
study to come out.
Okay,
So that's what you're looking at
good.
there.
Thanks. That's a good point. Anything else? All right, moving on to the big one.
Are you pulling up, Dan, or should I? Are you pulling up the big or the brief?
I have the packet, so so
Okay.
whatever's first in the
Makes
packet.
sense. I'm
Yeah,
not gonna walk through all of it, but I think it gives a little more detail.
Okay.
If that's okay. First of all, I had moved my note of what I wanted to share during the last section, but it does have to do with budget. So can I get away with saying something?
yes, of course you can.
I was notified today that for our 2026 budget, we have already spent our contract for substance abuse or substance use services. And so in 2026, we are putting in a halt on any new residential services for individuals or room and board if people have their own insurance and can't pay for the room and board section, because a lot of times or Medicaid won't reimburse that. We can't pay. They won't be able to go to treatment. So as of today, there will be no further treatment.
Okay,
And so that is going out to staff and people. So unless that you want to request money from like the opioid settlement funds to help people with opioid usage, that would be one option, but that can't be used for alcohol. And a
or other
lot,
drugs.
a lot of our individuals in Dunn County have alcohol use dependency. So that's an issue where we wouldn't be able to cover all that, but I wanted you to know, because
Yeah,
you hear
thank you.
that of people not getting services. And that goes to our partners too. So like, CJCC, other partners that use that. So I wanted you to be aware of that and that we budgeted the same amount for 2027. So be aware of that as well.
Oh, okay.
So it's a significant issue for us. So as we dig in here, I just wanted to put that out there. So for our budget, we have kind of the same mess, but it's a beautiful mess as public health, because I too am very pleased with how we're able to really define what the costs are for each division. And in our department, we have 12 divisions. And so the first division is our AMSO or overhead. And what happened in previous years is that divisions that could bill AMSO to their grants got charged for AMSO. Divisions that could not bill did not get charged for AMSO. So AMSO had a deficit in there and needed tax levy to cover those, although it wasn't a true picture of the cost of that division because it wasn't being billed to them along with indirect expenses. And so I really wanted to be able to say, what is the true cost of running this program or this division? And so this looks really different than when you're looking at 2026 or 25, because AMSO is something that covers the whole department and it's divided out by the FTE. So each division has so many FTE. It's split amongst all of that across the department and then billed by that way. And so AMSO shouldn't have any expenses because it's all divvied out throughout the divisions. And so that's what you've seen here. And there was tax levy in this before. What he did is take that tax levy and move it then to the divisions to help spread that across.
And I'm looking at AMSA. What are turnover savings?
That's that
yeah.
wage variance that we budget to kind of subtract out
Got it.
based on.
Okay, thank
And
you.
every division has that.
Okay, that's the
in-
first
in
time
every
I
unit,
noted that.
in every department. So at least I believe it's every department, right? Yeah. So With this, AMSL split across and the tax levy is also, and so that's why in the big budget here, as Dan goes down, you're gonna see where it says moved just a little bit. Yep, there you go. Move to clinic, move to birth to three, move to
yeah.
ADRC on here. That's because those expenses are based on their FTE and were moved in those areas over there. To be able to come with a zero balance is what it should be, because we cover the entire department. So if that makes sense, but that's gonna throw off the tax levy in all of the divisions because you're gonna go, well, why did it go up so much?
Right.
And how'd you get this new tax levy? Well, it's really not new. It just got moved.
You must have been reading all my question marks in here.
So in AMSO, I think that covers that piece of it. And then we have two divisions. So 209-44.02 and 209-44.03 is our aging and nutrition program. So two of them. So if you split those apart, that has never been done before. It was always in one big lump. So then we had to go, okay, what grants support, what funding comes in and supports nutrition and transportation, and what funding comes into the ADRC, how much tax levy is in each of them, how many staff, all of those kinds of things. There's still some things in here that, that aren't absolutely correct. Like, for example, shared IT expense, nutrition doesn't have any IT expense. Well, they do. It wasn't
Sure.
split. So we'll get that as soon, what's going to happen is the invoices come in, they're going to be correctly charged. Next year, we're going to go, yep, they're split, which will make sense, but to go in and try to figure that all out at this time doesn't make sense with that. The other piece is in here, when the conversion happened between SAP and BSNA, there was kind of a information dump, can I say? Where we have, when we try to dig down to go, what was this expense in 2025 or 2026? There's this long spreadsheet of numbers and you can't really dig into like, what does that mean? And so that was a challenge because changing the account codes, the general ledger numbers or names, they didn't line up. And so administration or finance, the contracted person had to figure out like, what does this kind of fit in here? Because it's not exactly the same. And some things are confusing. KT brought up educational supplies.
Mm.
Educational supplies for an employee is a different GL than educational supplies for a consumer. Well, unless you know some of this, they get dumped in different ones because there's
Right.
no way that
Sure.
finance is going to know what that was for, right? So they're kind of like, there's some of that that's going to be really wishy-washy in this budget, that when the actual invoices are coming in from 2026, 2027, we're going to have a lot better identity of what that
Got
is.
it.
So I'll give you a perfect example in ADRC. It shows that we paid $160,209 on staff appreciation in 2026. Tracy still is like, I can't believe that's on there. That like people are just going to think the worst thing. And we're like, we can't figure out what that was. We have no idea where that got dumped from. I can tell you they did not take a trip around the world.
I didn't think so.
But it's in there and it looks kind of weird. So like, then you go like, what was that? And we're not really sure. So it's like, okay, what are we missing here? We really don't know what that really was. Where should we? So we didn't put it anywhere because we didn't know. So there's some of that kind of stuff that I think as time goes on, we're going to be able to see a lot of picture with that in there. So I wanted to share pieces of that as we.
Could I speak a little bit to the staff appreciation? Yes, this has been a
laughing
topic,
topic,
right?
sad.
So yeah, you take an item that was like general office expenses or operating expenses, which was the GL line in the old system. And then we said, all right, in the new system, it's going to be one of these 10. By chance, the first of the 10 alphabetically with staff appreciation. That's why everything got put into staff appreciation as opposed to
Interesting.
any other one. So
Okay.
a portion of that, and I think it's budgeted at $385. is
Right.
Staff appreciation. So it was just yes.
Yeah.
Luck of the draw.
It was a luck of the draw, but it just looks awful on Tracy's side. So I want to tell you.
Which is why I want to.
He's not going to be fired. We really didn't take the trip around the world, but it is really hard to tease out because what you get is a spreadsheet of dump kind of numbers. So,
Yeah.
so just so you're aware of that kind of craziness that comes with it. So AMSO, ADRC, nutrition, any questions in those areas? Okay, then we're going to go to birth to 3. That one's a pretty clear one because it's pretty in and out. It's a lot of salary and wages or contracted services for our OT. We contract for, so that's a piece of that. So really birth to 3 is a pretty simple, not much complication in there. Or things to highlight. So the next one I want to go to is behavioral health clinic. And that Dan spoke of earlier.
Mhm.
We really changed this around. It had previously been all a behavioral health clinic, our crisis program, all of our placements, anything that had to do with behavioral health and outside of like CCS, CLTS, like some of those other programs, but the general things were kind of all dumped into this area. As we've grown bigger, that has really been an issue because we haven't been able to really get a feel of what is the clinic doing? How much does it cost? How much is coming in? Because it's really hard to say, are you self-sustainable when you're also paying for IMD cost, right? And that's really not the clinic. So we cleaned all of that up this year through this process and took all of that out. So really the clinic is truly our behavioral health clinic. It is our therapist, it is our advanced nurse practitioner, it is our nurse, it is our education and employment specialist and the manager in the clinic. And that's what it is. And so we're going to be able to really take a look at what is the billing, what are we on, what is the performance with the billing and those kinds of things. And that's an area that I'm excited to kind of hone in, put some shape around it and be able to determine. And then if there's other areas that are using the clinic, then they would reimburse the clinic for those services. And Dan talked a little bit of like crisis doing that in that pot of money. So really the clinic should be self-sustaining. It shouldn't have tax levy in it. So that's why you see it that way with no tax levy, where in other years there was because it was paying for other things.
Sure.
Okay, so any questions about clinic?
Doesn't look like it.
Okay.
And you can see the crisis number right here.
Mhm. Yeah. So then we go down to, where are we at next? Are we in crisis? Oh, CLTS. Okay. CLTS is a program that we set a rate to help cover our costs, whatever we don't get through billing and or the reconciliation process, we get through the reconciliation. So besides the MOU or the amount of money that we need to pay as a county that's designated for us, the rest of it is through Medicaid. So there's zero tax levy in there besides the MOE, which is about $54,000. And some of that we get out of another grant. So it's not even that whole amount, but so we have that in there with CLTS, and then we go to CRS next, I believe. This is our new program that we're still working to get off the ground. It's got a part of our manager salary and it's got part of the, the services that will be used and then Medicaid to back that. There'll also be a reconciliation that comes with that. So if we do all of the financial calculations correctly, that should come in at a zero as well with no tax levy. And that should help. I'm working to also help take some of the costs that currently are being paid fully out of the Family and Children's Unit to this new program where we should be able to get reimbursement there. So I'm hoping that lessens some of the burden of that unit also. So that's the goal, to get going on that. Any questions about CRS, CLTS? Okay, CSP. This is the program, again, that works with people that have chronic, severe, persistent mental illness in the community. It is a program that we get a percentage of, well, we get targeted case management for the services of caseworker or social worker there. And then we get a reimbursement rate for some of the services that we have. And then there's WIMCR reconciliation that comes in there, but it doesn't pay for the full amount. I think it's like 61% of the cost because the state takes a chunk out of there. And so the rest of that is then tax levy in there. So you'll see that as part of the program. It's got real clear guidelines of what you have to provide for supports. And so there's not a lot of like operational things besides the, the services that are part of that package. Okay, anything on that?
Your salaries went down in that area.
Trying to think of why. There's no people in CSP. Not sure what that was. I missed that. I have to dig into that, Dan, because I wasn't focused on salary because that was something that we had no control of, but okay. Let's see here. All right. SP next is CCS.
CCS.
That one is a fully Medicaid reimbursed program. So money expenses are reimbursed by revenue and then through WIMCR as a back end reconciliation. So there should be zero tax levy in that program. That got cleaned up because what was in there was the whole ball of wax. So the providers in the clinic that were providing CCS services, the revenue was going into this account. So it looked like we were making money in CCS, which you can't do in a Medicaid program is make money. So now we're going to have that revenue in the clinic because it's the service they're providing and billing for. It was okay when we're small maybe, but now that we've gotten bigger, we want to have it in the right buckets. So that was a little cleanup there. Any questions on CCS? Okay. And are we in crisis now?
Yeah.
Okay. So this number is
Are we in crisis?
we are in crisis. Yeah. So yes, the money got moved or the expenses got moved to this category. So all the placements, everything, but also the grant that supports a lot of that, which is grant 22, a state reimbursement grant. We moved that into there as well. So the funding that should support some of that. So it looks a little wonky with reduced amounts, but that's because of some of that grant movement as well in there. So, yeah. Let's see here. Do you have any questions about crisis? Okay. Yes.
Just a
Oh.
comment. So for crisis, we're saying 3.1 million in expenses, but it's only 860,000 in actual levy.
Yes.
So
Because there's grants in there, there's different things. We also bill for targeted case management, so we get some funding there, and then we pick up WIMCR for a little bit of that as well. Not in the placements, but in the actual crisis program.
yep, it's only a quarter of what it's costs.
Yep.
Yep.
Mhm. Yep. We are in ES. Last year, there was some challenges with the ES budget that never got cleaned up when it was submitted. We have an MOE that we have to pay, which is basically the staff cost for our county, and then anything that goes over, we're able to bill 50% of that to, well, it used to be 50 to state, 50 to federal. Now it's
Now it's
75, 25, right?
25,
But
75, yeah.
it should have been a increase in tax levy underneath that program, and that did not happen. So we had to kind of look at that this year. So that's why you're seeing a little bit different increase in that piece, because that is our obligation that we have to do as part of the consortium model that we are in and the contract that we have. So it looks a little larger because it is a little larger with that, and that's actually what it should have been in 2026. It just never came out that way. And then we are in family and children's. Again, this is all of our placements, that this number really
Yep.
went up. You can see that in the placement from 523 to 1.6 difference there. So some of you were not at executive committee last night where I explained some of this, but this is that risk factor of, who do we actually have? What do we know about the predictions of how long their placement would be? What does that look like? How, all of those kinds of things. So through lots of grueling efforts, we did try to, like, every kid that's in a high cost placement, what will this look like? How many months? What's the projection? When do they turn 18? All of those kinds of things to help navigate that. So this is the number that could be our best guess. But again, like I said before, we had 4 kids this week, right? So that can change. And all of a sudden somebody can start surprising us and do really better, or a family member could step up and say, hey, I think this is the person's at this place we'd be willing to take. So it is a calculated risk of what is that number. But in the end, whatever it is, we do the best we can, but it is there. So that's where that's sitting. So you see the bottom line of,
Supervisor
Oh.
Bashan.
So for the placements, you're going up to the 1.6.
six,
Is that before the 1.2 additional we talked last night?
that's part of that, right?
And
In
that's
there.
already there.
Yeah, so it's the 500,000 to 1.6, which,
it's not
yes, I
another
get is
1.2.
1.1. Yeah,
Okay, so
but there is also a,
going to 2.8.
yeah.
Yeah.
There's also a reduce in a grant that was paying some of these. That's where the 1.2 change comes in.
Came through. No.
Yeah. Okay, any other questions? All right, so the bottom line is,
Well, we have 18 in revenue and 19 in expenses, 19 and a half. 1.5 difference basically on my quick math. Oh yeah, next page is the perfect math, 1.46 or 76.
so I did some calculations, really simple calculations, but for the programs that we supervise here at Health and Human Services, we're basically down $1.7 million plus some change. It's about, 17 million. Yeah. Yeah.
Yeah. And I think one of the things as you look at that, and as we went through, and that was what we had talked about at the executive committee, is identifying the big changes outside of the salary and fringe component. And the
Yeah.
only thing that comes out of this committee that was a part of that is the placement costs.
Yeah.
So.
Yeah, exactly. Okay, any further questions? If not, round 1 budgets have been reviewed. And we have a budget amendment. And I don't know, Paula, if you want to give us any updates on this. It's a grant.
sorry, so we received additional family caregiver support grants. You know, at times they send out additional funding and say somebody didn't spend something, so we're gonna give everybody additional, right? That's fun. So we definitely can use it in our nutrition
Sure.
program, and so that's what that is. We did pick up that, for some reason, an old form was used, so Kelly's name's on here, but Jerry updated it, and so the
I
right,
didn't
right,
even see that.
right, people's names will be going to the next committee level, so, yeah.
Okay.
Yeah. So-
Okay. Any other clarification needed on this? Not, I will need a motion to approve the resolution number is not on here, the budget amendment. Supervisor Sean moves, Supervisor Welsh seconds. Any further discussion? Discussion? If not, all in favor, say aye. Aye. Any opposed? Budget amendment passes. And I don't know if we have any announcements or anything else. If not, we are adjourned. And thank you all very much. It's been a long meeting. And thanks for your hard work. And I appreciate it. We all appreciate it. Yeah, absolutely. And thank you, Dan, who probably after his day could use a little break.